Hi, I'm Dr. Bhargava. I have a few interesting cases to share with you in this short video. Our first patient has history of breast cancer and presented for an FDG PET-CT scan. On this rotating image, we find that there is some recurrence in the region of the left axilla, and on the fused images, we find that the patient has a left breast implant, a focus of recurrent breast cancer superficial to the breast implant, and then metastatic lymphadenopathy, which is pretty hypermetabolic in the left axilla. The interesting finding is in their abdomen and pelvis, where we found free air below the right hemidiaphragm, and also a focus in their abdomen, which turned out to be an inflamed diverticulum with surrounding fat stranding and focal free air. So this patient had diverticular abscess that had perforated, and these findings were seen on their PET-CT scan. And so once in a while, we see acute findings when we're reading FDG PET-CT studies, and it's important to recognize those findings and report them. This is a good article on acute findings seen on FDG PET-CT and how to differentiate them from malignancy. Our second patient has a history of a neuroendocrine tumor arising from the tail of the pancreas and invading the spleen. We performed a gallium dotatate PET-CT for whole body staging. We see on the rotating image that they have this large mass in the left side of the abdomen with intense uptake. They also have a focus in the liver consistent with metastatic disease. So this is their primary, invading the spleen. This is a liver metastasis. And the interesting finding here is that the tumor has invaded the portal vein, and we see the tumor growing into the branches of the portal vein inside the liver and also going into the SMV and its branches more inferiorly. And so this finding is consistent with the tumor thrombus. Here is their diagnostic CT showing the liver met, the large mass in the left upper quadrant, and tumor invading the main portal vein into the liver and then extending to involve the SMV. On this slide, we have an interesting paper, a systematic review and meta-analysis on the role of somatostatin receptor PET-CT in patients with neuroendocrine tumor. Our third patient has history of melanoma and presented with FDG PET-CT scan to look for recurrent or metastatic disease. On their whole body scan, we find that there is a focus of increased uptake in the pelvis, and this focus corresponds to the uterus, as we see on this fused axial image and also on the sagittal image and here on the coronal image. And so would you consider metastatic melanoma? Because melanomas are notorious for going to solid organs, subcutaneous tissues, muscles, brain, you name it, any tissue can be involved. Or this could be a second incidental endometrial cancer in this postmenopausal woman. And so the next step in their evaluation is to do a pelvic ultrasound. Here on these transvaginal images, we see the uterus and a thickened endometrium on the long axis view, and also the thickened endometrium on the short axis view. So this was biopsied, and an incidental second endometrial cancer was found in this patient. So frequently on FDG PET-CT studies, we incidentally find second and sometimes even third cancers that are subclinical or asymptomatic in these patients. This is a good review article on the role of FDG PET-CT for assessment of endometrial and vulvar cancers. Thank you for watching.